Hi, Bassett caregivers and practitioners. So today I'm joined with Cailin Purcell, another member of our executive leadership team, currently serving as Vice President and Chief of Staff. Cailin has been transitioning to her new role over the past couple of weeks, having been serving as an integral member of Bassett Medical Group for quite some time now. And I'm super excited to have Cailin join us today to tell us just a little bit more about herself. So Cailin, thanks for taking time out.
Thanks for having me.
So tell us about yourself.
Well, like the other couple of members of the team that you've already interviewed, I too have had a long career in healthcare. My first role was actually over 35 years ago as a messenger in Ellis Hospital. Little did I know at that time that that was really going to be, the seeds being sown for my long career that I have embarked on. So growing up in Schenectady, New York, I'm also the oldest of five, which is an interesting place to be in a family. So after a gap year in high school, which I now understand is when you take a year off from high school, but I entered Hudson Valley, which is a 2-year school, and was heading toward being a dental hygienist. After the first year, I recognized I had some higher aspirations and decided to pursue dental school, which meant I needed to go to school and get my bachelor's degree. So headed off to SUNY Buffalo, where I majored in biology and then also was minoring in psychology. And I'm not sure if it was the inorganic chemistry, the biochemistry, the organic chemistry, but at some point my minor became my major and I really started pursuing psychology and completed that degree in Buffalo. I should mention here too that I've had a lifelong passion for people's stories. I'm completely fascinated by the human spirit and people's desire to and ability to persevere and overcome. So it was kind of a natural transition that I started pursuing psychology. And after Buffalo, I transitioned into a program, Master's in Counseling Psychology in Boston, Cambridge, Massachusetts, which also fulfilled a childhood dream of living in Boston. So after I graduated from college, I returned to the Capital District and spent 16 years in different roles within my field of psychology. Initially starting in a prevention program at St. Anne's Institute, where I worked with children, at-risk children, running groups, working with families, community members, courts, and then headed back to Ellis Hospital, where I worked for a number of years on the inpatient, adolescent, and adult units, and then added crisis management to my repertoire and did assessments in the emergency department. After that, I had a great opportunity to start really an upstart business where I was able to partner with a couple of people and open a private practice. It was a specialized psychiatric medical practice, which I ran for about 8 years, started from the ground up. From opening the doors to selecting carpets to writing the policies to negotiating contracts. And I did that for, as I said, about 8 years. And then life happens, things change, not always what you predict. I left the practice and started working at St. Peter's Hospital in their addiction program, where I was part of the executive team and an education specialist. And at that point, started doing some more project management, education, community outreach, and really started to do some more operational type work, business work. And at that time was pursuing my master's degree or my MBA through SUNY Albany in the executive program, which was a weekend program. And after a couple of years there, love brought me to Oneonta and Cooperstown. So that was about 12 years ago. I came to the area and started pursuing my life here, which brought me to Bassett. I've had 10 years here at Bassett Hospital, starting out in a management program, a manager position in the Department of Medicine in the pulmonary department, and then quickly elevated to the administrative director for the Department of Medicine. And then about a year later, transitioned to the senior director of medicine, and I spent about 7 or 8 years there before an opportunity was presented to me to kind of lead from a different seat. And I transitioned over to the Department of Surgery and Women's Health, where I was the senior director. And not long after I got there was the opportunity provided to me to then add anesthesia and perioperative services to my work. I have to say this, that my career has been so far, each position has provided a different opportunity to expand and grow, to add additional responsibility. And it's just been a remarkable opportunity to work with people, to work, to build teams, to do projects, to take care of people, to take care of one another. It's been a great experience so far. I've also been on a number of committees throughout the organization and continue to try to find ways to interject. But I think some of the proudest things that I've of my career, particularly here at Bassett, that when I think about it, I really cherish are there was a project where we brought together the Sleep Network. So that meant working with Fox, Skill, and Bassett to create a network, and that's when being a network wasn't really cool, if you will. And it was the idea I had to, and offer to actually had Fox be the lead rather than Bassett Medical Center, which was met with some resistance at the time, but I think was really a great opportunity for Fox and for us to let others lead. There have been endless epic go lives. There's been AOC weeks that have also had some historic weather events. And certainly the most recent, COVID event has been a very long, but very important time in the organization that I've been really proud to be a part of. And last but not least, I would be remiss in not mentioning my opportunities to work with people, mentor them, and see leaders advance their careers as well in the organization. So I hope it comes across. I love Bassett. I'm so happy to be here. And I have enjoyed and enjoy every moment that I'm here.
That's great, Cailin. Obviously, you have a really diverse background, great skill sets. I think you bring strategic sort of think to the group, but also operational experience, which I think is going to really benefit us. As you know, the chief of staff role is new to the organization in a very diverse and dynamic role. You're going to be working very closely with me. You're going to be working very closely with the executive leadership team. I think really helping to set our agenda moving forward, doing a lot of project management, as you're aware, but you're also going to be tasked with building out some new capabilities. We've talked about an administrative fellowship program. You're going to be taking over communications and marketing, which is really exciting. So what is driving you? What is exciting you most about this opportunity?
Seriously, it's an opportunity of a lifetime. I mean, this really presents, as I've mentioned to you previously, it's kind of a culmination of all of my life experience so far and my professional opportunities and roles to really hone in my skills to do this work. I get to create some organization out of chaos. I get to work collaboratively with the highest leaders in the organization while keeping the patient at the center of this work. I get to, continue to mentor, continue to build, continue to lead and connect the dots. So I'm ready to go, and I'm really excited about this opportunity and this opportunity to work with another team in marketing and communications that I've certainly worked with before, but to work really closely with and also utilize their skill set to also to supplement this work and to really get it going.
Yeah, that's great. I hope you still say that in 6 months from now. So we'll check back in.
Another interview.
We do have a lot going on, and I appreciate you diving right in so far. And it's been wonderful to get to know you and to organize you to the team. So tell us a little bit, something interesting about yourselves or something fun.
Okay, so this took a minute because I was trying to think what I could share with this group. But I think it's kind of an interesting thing about me is that I like bikes and I like motorcycles, which means riding on the back of a motorcycle with my husband. But you can also find me on any beautiful night like tonight or during the summer riding around Otsego Lake on my bicycle. Something I just really enjoy.
That's awesome, Cailin. Well, it's again a pleasure to have you on the team. I'm really excited about your leadership and all the great work that you're going to do. Thanks for your confidence to join the team, and thank you for taking time to talk to us today.
Thank you very much.
All right. Take care. Bye.